is Dr. Tami Prince, the nation's bedside doctor. It is Valentine's Day today, and I thank you so much for tuning in to my show, Health Tips with the Nation's Bedside Doctor, on Clark TV Network, where we believe in the future. If you have followed me, my show was previously on 108 Praise Radio, where we were voicing the gospel, and now I'm blessed to have an even bigger platform on Clark TV Network. My show will touch people worldwide to the tune of 105 million viewers. So thank you so much for coming and following me. And this is your first time seeing me, welcome. We can be viewed on Apple TV, Roku TV, Chromecast, Opera TV, Hisense TV, Fire Stick TV, and YouTube. So you should have no excuse to tune into this show. You've got many, many streaming options. So you could have been anywhere else on a Thursday evening. You may even have been stuck in traffic. I know in Atlanta, our traffic at 6 o'clock is a hot mess, but I am so grateful for you to be tuning in. And, you know, if you know anything about me with my shows, you know that I am completely transparent on this show. I bring you the most accurate and up-to-date medical information so that you can be in the know. And I don't hold anything back. I'm here for you. I'm not here for anybody else. I'm make sure that your health is improved and maintained. And that means the most to me. And you may actually, if you don't know me and this is your first time seeing me, say, well, what does the nation's bedside doctor actually mean? So let me give you a little background on how I got to be the nation's bedside doctor. I am by training an OBGYN. And so as a specialist, I may not be the primary doctor for patients. And when I see patients in my office and I am treating them for a gynecologic issue or an obstetrical issue, I need to know what their medical history is. I need to know how they're being treated with their primary physicians. And I'm asking them certain questions, you know, about diagnosis and treatment options, and the patients can't tell me a lot of times what's going on with them. And it's a combination of reasons why they don't know. Sometimes is that they're not spending enough time with their physicians and the physician is talking over their head. They're speaking medical terminology when you may not understand what medical terminology is if you have not gone to medical school like I have gone. So that is a reason. Sometimes patients are in denial with their diagnosis, and so they think, oh, it's just going to go away if I don't think about it. So there are a number of reasons why it happens, but I found it necessary to have a platform, and I started my consultant practice with the mindset that I am going to teach you how to be your own best advocate. When you are with me, I sit down and I pour through your records and I make sure that you understand every aspect of your medical needs. I make sure that I teach you how to maximize your 15 minutes, because while you think 15 minutes is a long time, is not. We're running from patients to patients to patients. And so you want to make sure that you get all that you need to out of your 15 minutes with us. And so that's what I do. I don't want you to ever be clueless or in the dark about what is going on with you. And I also want you to make sure that you designate one person that can be your spokesperson in the event that you cannot advocate for yourself. That means be it a family member or a close friend that may have your power of attorney, but one person that your physician can speak with in that event that you can't do it. And I don't want you to overlook that. I don't want you to ignore that. That is so important to be able to have that support in your life when you need it the most. So that's what I do. I'm trademarked as the nation's bedside doctor. That means that nobody can come and do what I do exactly how I do it. And I, like I said, am not here for the insurance companies. I'm not here for the government. I'm not even here for your family. I am here for you and you only. that's enough about me. So I actually am going to give you a little 5-minute consult with this show because we're now on TV. I'm going to do a little bit different than what I would normally do with my radio show. So with each show, I'm going to actually give you a little 5-minute consult before we get into today's topic and I introduce my guests to you. So my 5-minute consult is this. I was asked on Monday, which was a couple of days ago, to do an impromptu interview for 11 Alive News here in Atlanta about the measles. There is a huge measles outbreak that is happening, and so they wanted to speak with a physician who could walk them through why we're having this outbreak. Now, back in 2000, we actually eradicated measles through vaccinations. And over the years, people have stopped getting routine vaccinations. So now we're seeing an uptick in people actually getting the disease instead of getting vaccinated. So I looked on the CDC's website, and as of February 7th, so from January 1st of this year, 2019, to February 7th, there has been 101 confirmed and reported cases across 10 states of the measles. So I'm going to give you these states so that y'all know, if you're in these states, to protect yourselves. California, Colorado, Connecticut, Georgia here, Illinois, New Jersey, New York, Oregon, Texas, and Washington, okay? So these are the states where we're really seeing an uptick in the vaccinations. And most of the reason is because in these particular states, there are so many exemptions for kids and their parents getting these vaccinations. And all it takes is one person to bring the disease into these areas where you're not vaccinated, and now you have almost an epidemic, okay? So a lot of times in other countries that are not vaccinated, they may get the disease, they fly here or travel here, or we encounter them when we're over in their own country minding their own business, and all of a sudden, now you've got this outbreak. Usually, when we're vaccinating, we do 2 vaccines. One when children are aged 12 to 15 months, and then again from ages 4 to 6 years. And sometimes you need a booster in your teenage or adult years. I know when I entered into medical school, I had to produce a shot record, but because I couldn't do that, they got my titers, and my titers showed that my vaccination had waxed and waned, which is sometimes what happens with vaccinations. So I had to get a booster in order to make sure that I was immune again. And so the myth is that people who are vaccinated cannot get the disease. And that's not true. Because as I stated, your vaccination can wax and wane and you don't even know it. And now all of a sudden you encounter someone who has a disease like the measles or the mumps or rubella or polio, and you're exposed, just like a person that had not been vaccinated previously. So also for some of the jobs, obviously healthcare, we have to produce shot records and we have to be vaccinated. Your bus drivers, your daycare workers, teachers, those kind of professions we know specifically have to have their vaccinations. But in some other professions, that may not be the case. And so for that reason alone, we still need to have vaccinations. We should not be having diseases where we've eradicated them. We just shouldn't. Now, I will say this, and I was asked this in the interview about anti-vaccinators and how, 2 children decide to go against their parents' wishes and become vaccinated themselves. And I thought that was an excellent idea because children do have a mind of their own. They do read just like their parents read, and it's their life. if they want to be vaccinated to protect them, then they should have every right to do so. But I was also asked whether or not the government needs to get involved. And I don't necessarily think that the government needs to regulate. I think it needs to be regulated more on a local level, starting with your schools. Your schools need to not have as many exemptions as they do. Now, there are some people who are immunocompromised or have chronic conditions that cannot be vaccinated. Those are the only people that really need to be exempt from vaccinations. And they need to benefit from the herd immunity. How herd immunity works is everybody in your community gets vaccinated. Okay? So if you're in a community that does not have the appropriate level of vaccination, guess what? You're not protected through the herd immunity. Okay? You are exposed. And you can expose others because all it takes is one droplet to become infected. And that one droplet stays on surfaces for up to 2 hours. So you could come into a room an hour after somebody who had been exposed, and all of a sudden you're exposed. Okay, so this is a very serious issue. But I'm not one to trample on anyone's religious beliefs or any beliefs as long as they are rooted in facts. That means that if you can find studies that have been repeated over and over and over again and have come to the same conclusion, those are facts. Okay, but where the anti-vaccinators came into play, it's because of a false study that was done by a British doctor. And his name was Andrew Wakefield. So back in 1998, he actually recommended that further investigation should be done because he found a relationship between autism, bowel disease, and the MMR vaccination, or the measles, mumps, rubella vaccination. And so what was later found out is that he had actually been paid. So he had a conflict of interest because he had been paid to support a litigation by parents that believed that the vaccine had harmed their children. So in the medical field, we have to make sure that we have a level of impartiality. And we cannot get influenced by our drug companies or attorneys to start treating patients any differently than what has been deemed standard of care for our profession. And so he fell outside of that. He actually was investigated by the General Medical Council, which is the independent regulator for doctors in the UK. So I think it's similar to our medical boards in the States, where if a physician gets into trouble, then that board will come and do an investigation. So this council actually did an investigation. They found that he had not only a fatal conflict of interest, but he manufactured evidence. And his evidence could not be reproduced in studies, which means that we know that it's false. Because if it's true, it should be reproduced over and over and over again, and it wasn't. So the Lancet, which is where his original work was published, had to do a retraction, unfortunately. And as a result, I think the retraction happened in 2004, but we still have people that hold on to that belief that vaccines cause autism. They don't cause autism, because if it did, all of us would have autism. Okay, so that is debunked. Do not believe that for one moment, that vaccines cause autism. Autism is caused by something else. And I will have a show later down the road addressing autism. I also did a radio show about autism as well. So I want you to check that out. Another myth that surrounds the vaccinations has to do with a mercury compound that's used as a preservative, which is called thimerosal. And so they tried to link thimerosal to autism. Now, most of the vaccinations back in the day all had this preservative in it. They've now since taken this preservative out of the vaccines. So I think the only vaccine that may still have it is the influenza one. But even the influenza one is getting away from this preservative. So once again, It's not reproduced in multiple studies, so that's a myth that needs to be debunked. And another issue that a lot of the parents are having is about the scheduling of the vaccinations because, the scheduling has changed. It seems like there are more and more vaccines that children are needing now. Back when I was getting vaccinated as a kid, we didn't have the influenza vaccine. We didn't have the chickenpox vaccine. We didn't have the HPV vaccine. So there are a lot of vaccines that were not done when I was coming up that are done now. So yes, I do agree that it does seem like a lot of vaccines in a short period of time. So parents get concerned with that, and I don't blame them. I think that you definitely need to speak with your physician and try to work out a better schedule. You may not get one vaccine at one visit, but you come, say, a couple months later and get that vaccine. But I want you to be vaccinated. So whatever you need to do to get comfortable with that, I want you to do it. I want you to speak with your physician, have that conversation with them. Have that candid conversation and express what your concerns are. And hopefully your physician will take the time to be able to explain and address your concerns, and that the result is that you get vaccinated. Because what I don't want to have happen is people start dying again from these diseases when you don't have to. They've been eradicated for a reason. So, if you want to check out more about vaccines, please see my interview on 11 Alive News Atlanta's website. You can also follow me on Twitter at Dr. TM Prince 4, Instagram, Dr. TM Prince 4, and Facebook at The Nation's Bedside Doctor at Dr. TM Prince 4. I have all of this information up. And also, if you go to my website, www.nationsbedsidedoctor.com, and sign up for my weekly newsletters, you get all of my advice right there at your fingertips. So I'm getting off of my soapbox for a second. We're going to take a short break, but when we come back, I'm going to be talking with this handsome man, Dr. Michael Toka from Total Cardiology of Atlanta. We're going to talk about getting heart healthy and why it's so important. So stay tuned. I don't want you to miss anything.
Dad?
Just 1 minute, okay?
Hey, Bobo, do trees tell each other stories?
I'm sorry. I'm afraid I don't know that.
Hey, why don't we go find out? Listen.
Do clouds take naps?
I couldn't tell you.
Can birds draw pictures?
I don't have an answer for that.
Dad, do stars visit their friends?
Look!
Most of my they never graduated, let alone I'm trying to break that. My daughter motivation for me to go back.
It's been so cool to the life that us having have that.
I've been in foster my whole life.
Just be able to put it all behind, take care of his, be a good husband.
Work, studied hard, and it paid off. Not have
So much in our life.
never used but I need to do better.
Sure, it's really bright. The diploma is just to the confidence, unstoppable.
Find free adult education classes near you at finishyourdiploma.org.
I felt hope because you said rude. I my own voice.
A joke. Still.
Negative comments. I almost quit doing something that makes me happy.
Because about me that I'm embarrassed.
Me on the first day, I felt included, and I knew it would be okay.
Of you sharing, I share my own.
You were there. You helped me gain my confidence. I'm
We are back. Thank you for staying tuned to us. You know, today is the day for love and lovers, but we need to actually talk about the heart that actually gives that love, okay? While February is known as the month for love and lovers, February is also known as the American Heart Month, where we are raising awareness about heart disease and prevention, and that's really the key to living longer, productive lives, is just making sure that your heart is healthy. So it's never too late to learn how to be heart healthy at any age, because heart disease can happen at any age. We're seeing it younger and younger and older. So it spans. So I have my guest, Dr. Forrest Michael Toker, who is a cardiologist and cardioelectrophysiologist with Total Cardiology of Atlanta. He takes care of all aspects of heart disease and specializes in heart rhythm disorders. He strives to make sure, as a practice, that they take a holistic approach to each patient and treat each patient as an individual and not an illness. That is what I preach. We have to treat patients with dignity and respect and as an individual. Dr. Toka is originally from Pittsburgh, Pennsylvania. He received his undergraduate degree from Morehouse College of Atlanta, where he graduated with honors. This is how I actually know him, because I went to Spelman at the same time. He attended medical school at Case Western Reserve University School of Medicine in Cleveland, Ohio, which is my hometown. He completed his internal residency at Brigham and Women's Hospital, an affiliate with Harvard Medical School, where he was selected to be chief resident at the West Roxbury Veterans Administration Hospital. He completed fellowships in both cardiovascular medicine and cardiac electrophysiology at the University of Pennsylvania in Philadelphia. He is a member of the American College of Cardiology, the Heart Rhythm Association, and associations of Black cardiologists. His special interests include electrophysiology and understanding health disparities. So thank you so much, Dr. Toka, for coming on to the show. And, I just appreciate you making such accommodations.
Thank you for the invitation.
Absolutely. So people ask me all the time why, became a OBGYN. So I'm going to throw it back on you. Because there's so many specialties, when we're going through medical school and we're going through our clinical rotation. So we're exposed to a lot of specialties. What is it about the heart that you were endeared to?
Yeah, you're exactly right that this is people ask me all the time. It's a very common question. And, when I think about it, I always think, I almost feel like I didn't have a choice to not go into cardiology because, when I think about just growing up, my friends, family members, my father has hypertension. My brother-in-law has a weakened heart that doesn't squeeze very well. When I think about people I know, people in my family, friends of my family, heart disease is incredibly prominent. And when I think about things that affect people's, really affect people's lives on a daily basis. I think about the importance of treating heart disease. And so for me, it was important to not only do something that, where I was very interested in and felt like I could make a difference, but also something where I could make a difference with my friends and family members, with people who I saw suffering from certain diseases, thinking about high blood pressure, thinking about the effects of diabetes, thinking about people having heart attacks, people having abnormal heart rhythms. And I wanted to be in a position to do things that would help patients and help friends and help family members and help other people I knew who had those type of diseases. And I think, I and we all know people who have suffer from heart disease. And, it's the number one killer in the United States. More people are dying from heart disease than any other disease process in this country.
Wow.
And in many developing countries, this is becoming an increasing source of mortality. And so it's incredibly important in the United States and incredibly important globally that we're aggressive about treating heart disease.
And you hear about, like, athletes, for young people dropping dead of heart attacks and things like that. And you wonder, well, how is that possible? They look fit, but on the inside, their hearts are diseased.
Right.
And they're in trouble.
No, that's exactly right. And I have patients in my office who are range from 19 years old to 103 years old. And I think sometimes when someone looks at someone 19 years old, they think this person can't have heart disease. Whereas the reality is that, anyone can have heart disease. We have patients who have congenital heart abnormalities that have heart abnormalities from birth. But you also have people, especially now, who have heart disease at very young ages. And so we all have to be diligent and realize that some of the the lifestyle choices we make are important. The sort of knowing our numbers and doing the right things in terms of making sure that our heart is taken care of is incredibly important, whether you're 18 or whether you're 108 years old.
Absolutely. So let's talk about some of the common reasons why people have heart disease in the first place.
Oh, excellent.
So let's take it through from the very young to the very old. What's the most common reasons why the young may have it?
And some, probably the hardest part about heart disease, which affects the young, a lot, is that, there are genetic components that may, predispose people towards disease. So I have some patients who have very high cholesterols because of genetic reasons, not necessarily because of their diet. And so for those patients, they may be at risk for a heart attack in their late 20s or early 30s because they're, they have a genetic predisposition towards certain disease. I also have patients with very abnormal heart rhythms at very young ages because they have a genetic predisposition. So sometimes in the young, it's a genetic predisposition. But also some of the things that we may do, can lead to earlier rates of heart disease. And so, smoking certainly. So, smoking can cause accelerated atherosclerosis or disease in the vessels of the heart. The, certainly diabetes, high blood pressure, high cholesterol, all those things can cause, even at a young age to have heart disease.
And atherosclerosis is scarring, so that it causes the heart to not want to pump properly.
Exactly. So blockage, if you think about it like a drain pipe, blockages occur within the vessels around the heart and stop blood flow from getting to the heart. And so really when we look at that, probably one of the most interesting things is that, we think of this as something that happens when people are, 50, 60, 70 years old. Whereas the reality is when we look back at it, we see that scarring begin in the 20s. And so, the effects of, fast food, the effects of, sort of what our eating choices, the effects of, not exercising, those things really start very, very young and can get progressively worse. And we sometimes see the effects of it, at a little bit older ages. But those things have really started, very, very young.
Way younger. So that means that when we're young, we actually are not invincible. We actually need to be taking care of our bodies properly. We don't need to be eating fast foods every single day. But the reality is that some of our young people are in poverty. And that's all that they may have. So say, for instance, they do have to go to a fast food place. Are there any choices that they can make that maybe will cut back on that risk and not have as much harm as, say, a cheeseburger or whatever?
And the way I would think about it is that the average, diet is, unfortunately in this country, is probably not very good. That the average food that we have access to may not be the best, and especially in some communities, you may not have as much access to healthier options. And so, although things have gotten a little bit better, really we need many more healthy options available to people in a wider array of places. in many restaurants now, they at least try to have some healthy options. So in even in fast food, they try to have some healthy options. Things I would look for is one, if there's grilled chicken as opposed to fried chicken. So any grilled item versus something that's fried, like a hamburger is fried, French fries are obviously fried. Fried chicken is fried. Grilled chicken is a better option. So a lot of fast food places will have a grilled chicken wrap or something like that, and that's a better option, than other options. There are also, and they may be smaller restaurants, there's other more healthy, healthier food restaurants that may serve, salads, that may serve other things that are a little bit healthier, and there are some quicker options, be it, Panera Bread, be it, some of the there's smaller, sort of salad places with smoothies, things like that. There are healthier options, but it may take a lot more work to research those places and find where I am right now, what are the healthy places that are located around where I am right now.
Yeah, and there was a study that just came out about, they were looking at African American women and fried foods, specifically like fried chicken, fried fish, and how our health suffered way more when we were eating those fried foods as opposed to when we were eating the grilled options. Counter to what our counterparts may be doing. So there is a genetic component in how we may be processing some of these foods differently. The other thing I can attest to is about the cholesterol, because I was actually diagnosed in my 20s with high cholesterol, and it's for a genetic reason. I could eat perfect. I could work out 8 days a week. I'm still going to have the high cholesterol. So it's about knowing what's going on with you so that you can actually minimize other risks that may come about when you don't know.
Exactly.
Now, when you're middle-aged, what are some of the common reasons why you may have heart disease?
And a lot of times it's that combination of genetics, which is present in all of us, but also a lot of our lifestyle choices. And so, and the other thing to realize is that even some of the disease process we're talking about, be it like you're mentioning with cholesterol, a lot of times, high cholesterol, high blood pressure starts with people in their 20s. And so a lot of times, as you say, we think you're invincible when you're in your 20s, but really a lot of those things actually start at a very young age. And so it's important that people, we say know their numbers, that people know what their blood pressure is, and really, certainly if you find one time your blood pressure is high, you want to write down your blood pressures in a book, write down the time, the date, the blood pressure, and keep track of them, be it in a pharmacy, be it at the fire station, be it at home. If you find out one time your blood pressure is high, following up on that, my, brother-in-law was found to have high blood pressure in his early 20s, and by the time he, followed up on it, had a weakened heart, in his late 20s. And so this is in his late 20s, early 30s that his heart had already been very negatively affected by the blood pressure. And it's one of those things that no one said to him, you really need to follow up on this, even though you're only 22 years old.
And had he let it probably go on a little bit longer, he probably wouldn't be with us today.
It can be life-threatening. Exactly. No, that's exactly right.
Yeah.
And so it's one of those things where we need to start at a young age to say, I'm going to make healthy lifestyle decisions, do those things, so that it doesn't affect us as much in middle age. In middle age, even if we don't have any health problems, we need to say, I need to be doing the things that will prevent me from having problems in the future.
And I like what you were saying about the blood pressures and taking them down. What I always tell patients is take your blood pressure at the same time, same arm every day, because our blood pressures do fluctuate throughout the day, and it is always higher in our right arm than it is our left arm. So you just want to make sure that you're doing it the correct way each time so that we can see what pattern is happening. Is that also what you recommend?
Right, exactly. I think you did, well, and you want to do different things. I definitely think it's good to take it at the same time, the same arm each day to measure that. The other thing I might do is sometimes, at least occasionally, doing it at some other times to make sure that sometimes people are on medications for their blood pressure, and it may be that they're taking a medicine where their blood pressure is perfect in the morning but is higher at night. And so at least occasionally sort of, making sure you have that reproducible number at the same time, but then also saying occasionally I'm going to do in the evening or in the afternoon, just to make sure that you're not perfect in the morning and then in the afternoon or evening you're running high, because that blood pressure medicine for you is not in your system to the same degree at that time.
I like that. I like that. So when does someone need to come and see someone like you?
Well,
as opposed to seeing their primary doctor?
Excellent question. Excellent question. A lot of times, patients are referred to me from their primary care doctor, but there's other times where patients say, I'm concerned about this. I've discussed this with either my doctor or I haven't discussed it with my doctor, and I really feel like I want to see a cardiologist. I think one is listening to your own body, and a lot of times, if you are very concerned about something and you're saying, I feel like this is, I've discussed with my primary care physician, and I'm very concerned about this. I have certainly people with a history of heart disease, certainly people with chest pain, certainly people with abnormal heart rhythms or heart racing palpitations. All of those people, if they're concerned about it, or if they have this family history and other things, they should probably see a cardiologist.
Absolutely.
I was going to say one other thing just about the prevention piece, because I think we as doctors talk so much about once patients have medical problems, the things that they need to do in terms of medicines, in terms of other things, once they have medical problems. I think sometimes one of the most important things is what we can do not only when we have medical problems, but even beforehand.
Absolutely.
And just the general rules to healthy diet, which I talk to patients about. One thing is just, making sure to, in our diets, we have a lot of fried foods. We talked about avoiding the fried foods, avoiding adding salt to the food, because there's really already salt in most of the food that we eat. And so trying not to add additional salt to the food. Not eating a lot of sugar and desserts. We all have a lot of carbohydrate in our diet. Not eating a lot of sugar and desserts, making it a treat, not an all the time thing. And then eating a lot of vegetables, just because fruits and vegetables. But certainly if you're diabetic, focusing on the vegetables, just because we all don't have many of us don't have the right proportion of fruits and vegetables in our diet compared to other things. And so making sure that in one form or another you're taking a lot of vegetables. And then also just exercise.
Absolutely. And, as far as the diet, too, is concerned with carbohydrates, carbohydrates sometimes gets a bad rap.
Right.
But people don't understand what good carbs versus bad carbs. So let's talk about that briefly, good carbs versus bad carbs.
No, that's great. And so exactly. So all carbohydrates sometimes get lumped together. And so, people are lumping together eating an apple with eating, a piece of cake. And those are not the same things.
Exactly.
Right. And so that there's a lot of, things that we receive the nourishment that our body needs, from various fruits and vegetables. And we want to have a diverse diet of fruits and vegetables and that type of thing. It's the empty calories, empty carbohydrates that is a lot of times from processed foods or desserts that we want to avoid. And so try as much as possible to avoid those things, or again, making that a once in a while thing, making that a treat as opposed to something
every
that's
day.
daily. Exactly.
Yes.
And I always tell people, don't have it in the house. It's one of those things where if it's in the house, for most of us, it's going to get eaten. And so, at my house, we try to avoid having a lot of that type of thing in the house, only because the temptation is going to be there. And the further you are from the temptation, the better. The
better. Now, I will say, once I get the craving, I go ahead and do it because I find that I may binge if I put off that craving, which is back to your what you were saying about doing it occasional, not an everyday, but occasional is okay. Occasional is not going to hurt as much as you doing it every single day.
Right, and I think it's everything in moderation.
Exactly.
I think it's one of those things that for most of us, if we say never, I'm never going to do this and this and this again, it just doesn't work. It's just not something that we do well with. If we say, I've done very, very well this week with doing all the healthy living and healthy diet things I want to do on Saturday or on Valentine's Day or on whatever day I'm going to enjoy this, that makes perfect sense. But I think, sometimes saying never can be equally as bad as saying,
okay,
I'm going to do this
I'm going to do it now.
Yeah.
Now, let's talk about some of these diets that are out there. I get asked all the time about the keto diet and the HCG diet and all of these other diets. What do you tell patients about these diets?
And I think while there is value for individuals to certain diets, and I think everybody has to find out what diet's going to work with them, in general, a lot of the, we'd say fad diets or a lot of the diets, people change their eating habits and sometimes have drastic, can have a lot of changes, but it may not be for a long time if you're not going to stay on that exact regimen for life.
Correct.
And so I think everybody has to look at themselves as an individual and figure out what's right for them. But, in general for people, what I find has been more successful is saying, I know my diet or exercise habits and I know what the problem is. If someone eats ice cream every day, if they say, I'm going to eat ice cream twice a week instead of every day, and they say, but I'm going to do this for a light, I'm going to start that healthy habit for a lifetime. I'm gonna not change it for a week or a month or a year. I'm gonna do it for a lifetime. And if they say I'm gonna do this and then next month I'm gonna pick a different healthy habit, I'm gonna say, I also eat fast food 2 times a week. I'm going to change that to once a week and say I'm going to do that for a lifetime. And then maybe the next one they say I've been doing this once a week. I'm going to go to do it once every 2 weeks and do that for a lifetime. In general, for many people, I find that as opposed to saying I'm going to do this more extreme diet for a week or a month, say I'm going to make lifestyle changes that I make
over time
forever. Whatever I'm going to decide to do, I'm going to commit to it for the rest of my life.
I love that.
And sometimes smaller changes making small changes over a long period of time are much more effective than making a massive change for a short period of time. And so, I think that for many people works well. But again, everybody's an individual, so they have to look at what's going to work for
And
me.
you need to do this in conjunction with your physician.
Yes.
Always keep your physicians in the loop because we don't know unless you tell us.
Yes,
and we can't treat you properly if we don't know.
Right.
So
Right.
That's key. And I agree, too, about doing everything, once again, in moderation and over time is always best.
And I talking with patients and just even seeing, sort of what's available out there, you can understand where it's very, very confusing.
Absolutely. I get confused.
I mean, it's incredibly confusing. And I think, sometimes following simple rules is better than some of the very complex things and saying, I know I need to avoid fried food, or I know I need to avoid sugar and desserts, and figuring out ways to implement that into your life over time is a better way. Or saying I don't eat a lot of vegetables, and so I'm gonna, if you love broccoli, I'm gonna eat broccoli frequently, or if you love, whatever, I'm gonna make a smoothie every morning. Whatever it is, but figuring out ways to put those things in your life. And in a more simple way, rather than saying, these very complex regimens of I'm going to cut everything out of my life.
Absolutely. So now, what are some of the signs and symptoms of heart disease or even a heart attack, for that matter?
Excellent. Yeah, certainly we think about the typical signs of, chest pain, shortness of breath. The one caution with that is, and this is true in a lot of people, but especially in women, that those signs may not be that typical sort of signature of pain related to heart disease. And so, in general with heart disease, if people notice that they used to, walk or go up 2 flights of stairs without a problem, or 3 flights of stairs without a problem, and now they walk up 1 flight of stairs and feel much more short of breath or feel much more tired, that can be a sign of heart disease. If they have pain in the chest or pressure in the chest or heaviness in the chest, that can be a sign of heart disease. If people notice their heart is racing frequently, that can be a sign of heart disease. There can be many signs, and I think one of the most important things is literally paying attention to your body. As a physician, we know the medical knowledge, but no one, as a patient, no one knows that patient better than that person.
Absolutely.
And so listening to your body, and if you're, you used to do a certain amount of exertion and you can't do that anymore, it's important to find out the reason why. And not necessarily say, this is because I'm a year older or this is because of whatever. Oftentimes there's a reason why something is different.
Now, what about if somebody has intermittent chest pain? Can that be a sign, or is that just something that should be ignored? Like, you get a chest pain and then say, I don't know, a day later it may happen again.
So I would never ignore chest pain. I mean, there's many sources of chest pain. They can be from inflammation within the chest wall, be from something going on with the lung, could be something going on with the heart. But I wouldn't necessarily ignore it because that, potentially, obviously, there could be something life-threatening going on. And so I think talking with your physician, maybe initially with your primary care physician, and certainly if it's, if there's still concern or if it's serious, talking with your cardiologist and looking at it in more detail, and potentially, if necessary, doing testing to see, is this something that's serious? Because it's one of those things where people, have, sometimes ignore things and have something very serious happen and can pass away. So we want to make sure that people are if you are noticing it and it's, and it's
more often than not.
Right. It's worth getting it checked out.
Now, also with women, we tend to get some of the atypical symptoms like nausea and vomiting. I guess too, nausea and vomiting is also associated with other things. But generally, when we're talking about heart disease and heart attacks, what have you seen when nausea and vomiting has come into play?
And as you say, there are a lot of potential causes of nausea and vomiting. The yeah, a lot of times if you notice symptoms related to, after a level of exertion. So if you walk up a flight of steps and suddenly feel very sweaty, suddenly feel nauseous, suddenly that type of thing, that can be a sign that that's more related to the heart. But neither's an error. If you have sort of nausea and vomiting, I think it's worthwhile to get it checked out and say, is this related to the heart, but is it also related to, or is it related to something else? If it was related to gallbladder disease or related to other things, it may need to be checked out as well. And so I think a lot of times the barrier is saying, this is happening. I'm not going to ignore it. I'm going to go to my physician.
And that's key. Do not ignore what your body's telling you. Your body's talking to you for a reason.
Exactly.
So don't ignore that.
Yes, exactly. And so I think listening to our bodies is key.
Absolutely. Now, you mentioned testing. If we have some of these symptoms, what kind of testing do you, as a cardiologist, perform?
And it depends on the exact type of symptom. But for example, if someone has chest pain, for example, they may need a stress test. They may need where we either have them on a treadmill or do a medicine that simulates exercise. They may need that where we take images of their heart or pictures of their heart to make sure things are okay.
What are you looking for when you're doing a stress test?
Good question. We're looking for blockages within the vessels in the heart. And so over time, as we were talking about, there potentially can be blockages that occur within the vessels around the heart that can starve the heart of blood and starve the heart of oxygen if those blockages become too severe. And so we're looking to see if there's those blockages that may be causing the problem.
And a lot of times on the stress test, if there is, you can reproduce some of the symptoms.
Right.
That you may have at home, like the sweating and the chest pain and the shortness of breath. Am I correct?
Exactly. And then we can look at the pictures on those pictures to see is there some limitation in blood flow to the heart.
Now, when you see issues on a stress test or on the images of the heart, which is called an echocardiogram, what treatment options, and are there any different treatment options for the genders versus races?
And so depending on what we see, it depends on exactly what we see. If we saw a suggestion of blockages within the heart, the next step would oftentimes be to go and actually shoot dye within the vessels and see the blockage there and potentially open it up. If we saw there was a problem in the structure of the heart, in the valves of the heart, it may require other treatments and sometimes even surgery. If we saw that, and then we may see other things potentially on that ultrasound as well. Like the heart can be weakened, where the heart's not squeezing very well, which can predispose towards heart failure and other problems. And so really looking at
organ failure, because your heart is not pumping the blood to the organs the way that it needs to.
Exactly. And so there's a lot of different things that we can see, and all of which require different treatments. If sometimes we see it and it's completely normal, which is great, which is reassuring for the patient, reassuring for us. Sometimes we see it and there's problems, which may be something that could be improved with medicines, maybe something that needs a procedure.
Now, a lot of people go in and then they say, I came out and I had a stent placed. What does a stent actually do?
Good question. So the stent placement, and as you say, many people will get stents. If there is a blockage there, sometimes it can be opened up with a stent. What it is using a small balloon to open up where that blockage is, so that vessel is now open. And think about the stent as the thing that keeps it open. It's sort of like a fence that goes around the vessel and holds it open so it stays open there and doesn't close down again over a short period of time. It is important if you have a stent that you're on certain medicines that also help it stop from blocking up again. One of which is aspirin, and then another super aspirin type of medicine that help prevent it from blocking up again.
And so what those do is basically it keeps your blood thin. So we call those anti-clot. Drugs. So that's where aspirin comes into play. It keeps everything open. And you may be on some kind of blood thinner. And do you have to be on these medicines for life when you have this stent placed?
Not necessarily. So aspirin is oftentimes for life, depending on the person, and it's always individual. The other super aspirin medicines, oftentimes people will be on for 1 to 3 years, but it depends on the patient and their risk. But they don't necessarily have to be on all of the medicines for life. And we certainly want to constantly evaluate patients and say, what medicines do you need that will help you live longer and do better? And is there medicines that we can take away that you don't need that are not as important for you at this moment as opposed to before?
Absolutely. So now, Under what circumstances do people need pacemakers? And let's talk about the different types of pacemakers, because this actually goes back to what your specialty, or I should say your specialty within your specialty, because this is what your special interest is in, which is heart arrhythmias.
Exactly. And so pacemakers are a device that sits in the skin beneath the shoulder, and these typically, are for patients who have slow heart rhythm. So if someone's heart rhythm gets slower than it needs to be, the pacemaker will help remind their heart to beat at a normal pace. And so it's most commonly used for patients who have a very slow heart rate. We also place defibrillators, and defibrillators are for people who have a risk of having the fast, dangerous heart rhythms, like what you see on TV when people have to be shocked with the paddles. And it potentially saves people's life if they have those heart rhythms. It will shock them out of that and potentially save their life and make sure that they're doing better. And then there's special types of defibrillators that help out patients' heart failure so that their heart squeezes better and protect them from those fast, dangerous heart rhythms.
Absolutely. So one of my other specialties is that I'm an occupational medicine physician, and I do DOT certifications for our trucking industry and our transportation industries. And one of the big no-nos, which will disqualify a driver, is the defibrillation part. You can have the pacemaker, but not the defibrillation. So in that instance, how would you treat that patient? Would that patient be better treated maybe with surgery versus having the pacemaker?
Well, and so there's nothing that, for if someone has a slow heart rhythm, there's not a specific medicine that will increase the heart rate, or there's not it really is just the surgical implantation of the pacemaker if they have a dramatically slow heart rate. And we have a lot of pilots and truck drivers, and for patients who, again, we look very closely at it before someone needs a pacemaker or defibrillator, and they'll often talk with their job, and it becomes a complex issue of figuring out whether there's other roles that people can do or other things if they end up having a defibrillator. And then if with a pacemaker, a lot of times it's just getting it checked frequently.
So let's discuss what cardiac rehab is. We see this a lot in patients who have had heart attacks or some kind of severe heart issue, and we need to rehab them.
Right.
What does that mean, and what does that entail?
Right. And so cardiac rehab is if anything probably underutilized. It's a resource where there's supervised exercise and information on nutrition for patients who have had a heart attack or had other heart problems. And so it's that in a supervised version. So after having sort of a severe heart incident, this is something where patients go to a rehab center and they will have sort of structured exercise programs, other things, and sort of that slowly increasing the amount of activity that they're doing to try to prevent another episode of whatever heart disease they had.
Absolutely. So I strongly recommend having cardiac rehab. You're right, it is very underutilized. Why is that?
I mean, it's hard to say. Unfortunately, it's one of those things that I think not enough people are referred to cardiac rehab after having a serious incident, and I think probably it hasn't been publicized enough, the value of it. And I think many people would benefit from a more structured exercise regimen.
But cardiologists know that that's important. Am I correct?
Oh, yeah.
So I guess my question would be is why more people are not getting referred if cardiologists know the importance of that?
When I think some of it is the amount of the number of cardiac rehabs, the availability of cardiac rehabs, and there's always complexities with insurance companies getting them to pay for the cardiac rehabs and that type of thing. So I think all of those complexities go together, and then some people don't think they need a cardiac rehab as a patient.
Like, I'm fine. I feel better now. I can just take some medicine and go home.
Right. And so I think it probably a lot of it is that we need to publicize with patients that how important cardiac rehab can be. Secondarily, we need to make the access to cardiac rehabs more available, and also make sure that it's getting compensated for patients. Just because it can be difficult for patients to pay for, after having a long hospitalization and other things, it can be very difficult for patients.
And I would think that we would want that, when people get hurt, or they've gone through orthopedic surgery, we do physical therapy and occupational therapy. So it would stand to reason that we should want to rehab the very thing that keeps us living, You know, this organ means everything. If you don't have your heart,
right.
I mean, your other organs will shut down essentially.
Right, exactly.
So I would like to see some lobbying from our medical societies more on that to get that covered through the insurances.
Right. No, exactly.
So we're going to take a small break, and when we come back, Dr. Toka and I are actually going to do a little CPR demonstration for you. So hang tight. We're coming back soon.
Your girl through every life. You felt time. You felt most when you realized you would never be. They were with you, shared your love with the world. And in your world. Your left you. With you right now. But how well do you know them? Knowing your breath can
Look at you. You're at the top of your game. You're unstoppable. Nothing can throw you off track. Wait, is that your car? Uh-oh. Yeah, I saw that coming. That will throw you off track. You're looking at around 10 grand in fines, legal fees, and increased insurance rates. Let's try this again. Smart move. Because buzz driving is drunk driving.
Okay.
We are back, and we are getting ready to do a little CPR demonstration. So I could not find a regular CPR mannequin, so we're going to use Baby Alive today, but I want you to imagine this as a full-size adult, okay? And, you know, why CPR is important is because you want to do it properly. You may be the only person that is able to save another person's life. So CPR is essential to learn. There are multitudes of CPR training courses in the big cities, and it's well worth the money, I think, to be able to do the CPR training. So we're going to do a little demonstration, but this does not substitute you getting the proper training for this, okay? We're just going to show you how to do it, and then that will put you ahead of the game when you do finally get certified. You can check multiple websites. I know you can do American Red Cross. And there's, you know, plenty of other places that do it, but the American Red Cross is going to be the biggest training facility to get this done. It's not just for healthcare workers, it is for everybody, okay?
And we were talking about a story earlier about a patient of mine who, you know, had, as part of his job, had done, you know, basic life support, and, you know, realized, and then, you know, years later realized that his wife was actually having a cardiac arrest. Her heart had stopped in the middle of the night. He started CPR and saved his life. So I think it's not just something where you come on an accident scene and help people. It's really something where you could save a friend or family member's life. And it is important that as many people as possible learn basic life support.
Absolutely. Okay, so during this demonstration, like I said, imagine Baby Alive being a full-size adult, okay? And you may be laying next to that person, you may be sitting next to that person, Baby Alive may be up, and all of a sudden they go down, okay? And so what is the first thing that we should do?
Well, so the first thing you want to do is check their pulse and check if they're breathing. to see if
Baby
they're
Alive,
breathing.
are you okay?
Yeah, try to wake them up, try to see if they have a pulse, try to see if they're breathing, and if you notice they're not doing those things, you want to call 911. The first thing to do is have someone, or if someone else is around, call 911. Sometimes with CPR, one of the concerns that we get into is that people will start CPR but not have someone call 911. And while you want to initiate CPR, you also want to get professionals involved. So if someone is around, if you're somewhere, even if there's people you don't know, telling someone to call 911 while you're initiating CPR is very important.
The other thing that's important too is that if you are by yourself, we always say start CPR first, do 3 cycles, and then call 911. The reason is because you want to get your CPR, your chest compression started immediately. So you see someone going down, make sure that they're on a hard surface. Right now, we are on a table. But if the person is in the bed, you need to get the patient or the person down to the floor. That's the hardest surface that we can get a patient. And you want to make sure that you're standing to try to get better vantage, okay? So if you are untrained, that means somebody that has not really gone through formal CPR training. You've just seen it maybe on TV or even obviously on this show. You're going to do chest compressions only. And that's because we know that we have to get the blood flowing to these other organs, especially the brain, because we've only got, about 8 minutes?
Right. A very short period of time. It depends on the person, but you really have a short period of time that you have to get blood flowing to the body. Let me just step back for a second. The reason why you want them on a hard surface, given the option, if it's possible, is because you can't do effective chest compressions if someone's in a bed or not on a hard surface. So if it's possible, sometimes it's not possible, moving the person to a hard surface is definitely recommended.
You've got to get your leverage going. So the way that we do the chest compressions, you're going to put one heel down, you're going to clasp your fingers, and you're going to boom, 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 boom. You're going to do it rapidly, 100 times, okay? So I'm not going to do this 100 times, but I want you to know that you're going to do this 100 times, okay? And you're going to do 3 cycles of this before you call 911 if you're untrained and by yourself.
And oftentimes the issue is having enough pressure. Remember, you are beating for that person's heart. That person's cardiac arrest means the heart is stopped. And so when the heart is stopped, you want to do enough of the, you want to, with enough pressure to be pushing the heart, and you're squeezing for the heart. So you want to use 2 hands, and you want to put enough pressure. And exactly as you said, you want to be standing above someone, because you, a lot of times when you're standing away from them, you cannot put the pressure on. You got to be right
over top. And you're going to do these chest compressions. Now, if you are trained, like myself and Dr. Toka, as medical physicians, we can do what we call 30 to 2. So we're going to do 30 chest compressions, and then we're going to take, after we do that, 2 rescue breathing. And what we're looking for is we're going to fit our mouth right over top of the other person's mouth, and we're going to watch the person's chest rise. Obviously, Baby Alive is not going to rise right now, but if you're doing it properly, you will see that person's chest rising. You'll do 3 cycles of that, then call 911. Okay? If you're a 2-person one, you designate, like Dr. Toka said, that one person to run while you begin your CPR. Okay? And then when that one person comes back, then you can go 30 to 2. But while you're by yourself, you're going either 30 to 2 for a trained or 100 compressions, no breath if you're untrained. Okay? And the other thing we're now seeing too is defibrillators are more and more in places like schools and on our planes and things like that. Why is having a defibrillator so important?
Yeah, exactly as you say, a defibrillator is extremely important, because if someone is in cardiac arrest, if they're in a dangerous heart rhythm, again, like you see on TV, the only thing that will, or the fastest thing that will get, and most effective thing that will get them out of that rhythm is an automated defibrillator. And so the automated defibrillator, even if you've never used it before, the defibrillator will tell you what to do. And so, and certainly if there's a trained person there, allow them to interact with the defibrillator. But, putting the defibrillator on the patient, it will analyze the rhythm, make a decision about whether to shock the patient. If it does need to shock the patient, you want to step away from the defibrillator, step away from the patient, not be touching the patient when it shocks the patient. But that will potentially save someone's life. And so if there is a automated defibrillator, immediately after, if there's two people there, immediately after calling 911, you want to see if there's an automated defibrillator, an AED. Certainly if you're at the airport, there's many AEDs. If you're at a stadium, if you're, many places now, schools, as you say, there's AEDs. And so you want to ask, if you're not familiar with whether there's an AED there, is there an AED in the area?
Absolutely. And two, the other thing is you don't want to touch the person because you don't want to pick up your own rhythm, because the defibrillator may detect that there is life because you are living, and then they're not going to shock that patient when in fact it needs to shock.
Right.
The other thing is, do not be afraid to break someone's ribs. I remember when I was in residency and I came across a cold and it happened to be a smaller person. I actually did, because I was doing chest compressions correctly, I broke a couple of ribs. But I'd rather have your ribs broken and you're alive as opposed to you having perfectly intact ribs and you are now 6 feet under. So don't be afraid to crack some ribs.
And making sure you're using the adequate pressure, to try to make sure you're causing that heart to squeeze.
Exactly. So we know that it only takes how many minutes for the brain to start dying?
And it varies with the person. In general, people will say 8 minutes, but a lot, therefore, depending on the individual and their system, it may be a shorter period of time than that.
Okay.
Yeah.
And then how long does it take from person going down to, say, dying?
And again, it varies with the person, but you want to approach the situation as quickly as possible. Get them defibrillated if an AED is available. As quickly as possible, do start doing chest compressions, and as quickly as possible, call 911.
Absolutely. So I want to thank Dr. Toka for coming and spending his morning with me, and with you all, giving much valuable advice on cardiac disease and how you get healthy. I just want to make sure that we go over. Please take control of your heart. Stop smoking, manage all of your chronic issues, take your medication if you're supposed to be on it, make heart healthy eating changes, get and stay active. And, make sure that you keep your physician in the loop. That's the best thing that you can do. So I want to thank you again for tuning in with Health Tips with the Nation's Bedside Doctor on Clark TV Network, where we believe in the future. Please join me next week for more important health topics that we're going to discuss, and blessings to you until we meet again.